Around the world, people are taking off their masks as restrictions ease. Many people are no longer scared of COVID-19 and are enjoying more freedoms. But some doctors warn against not taking the coronavirus seriously enough. The pandemic is far from over. Also on the show, why have some countries apparently gotten through the pandemic better and faster than others? We head to Dubai, which advertised itself as a safe tourist destination while borders were closing everywhere else. But first, let's take a look at Nigeria. The African country has escaped relatively unscathed by COVID-19. With a population of 206 million, only 200,000 cases were reported. And since February, infection rates have fallen sharply.
On the busy streets of Lagos, you might think there had never been a pandemic.
We are not selling again like before. Everybody, they are not buying. They are not buying it.
Okay, so there's no need to be wearing face masks because obviously there's no COVID. Like, look around, we're not wearing face masks.
Most Nigerians believe there's no COVID. And because of that, they don't want to wear the nose mask again. Even in stores, offices now, people resist when you insist they should wear.
Nigeria only recorded about 200,000 confirmed COVID-19 cases and 3,000 COVID-19 deaths. Compared to other countries, these are very low numbers. Charles Edosomwan is a data analyst. He's been documenting the impact of COVID-19 in Nigeria and looking into the reasons why Nigeria seems to have largely been spared.
We have a lot of gatherings in Nigeria and things like that. But if you look at the percentage of the population that were being infected in Nigeria, it would be about 0.1% of the entire population. So it means in every 100%, there's a possibility you might not be able to find one person who's infected. And in 1,000%, there's a probability you would find one person who's infected.
Grover's Hospital is fully licensed by the Lagos state government to treat COVID-19 patients. It recorded high rates of COVID-19 cases in the past, including hospitalizations. But Dr. Grover Arnils says that has now changed.
In last 5 or 6 weeks, we have not even seen one critically sick COVID patient who needs a hospital, ICU admission, or a treatment inside the hospital.
Only 19 million Nigerians are vaccinated, which is 38% of the population. Nigeria doesn't have enough vaccines to go around. Many people don't want to be vaccinated anyway.
I'm normal. I'm okay. My body is fine. I don't need to take the vaccine.
Taking a COVID vaccine because when you are taking the vaccine, you know why you are taking vaccine. Why are you taking vaccine? Because COVID-19. Is there COVID-19? I don't believe COVID-19 because COVID-19 does not exist in Nigeria.
I'm ready to take it. But when they already confused me, I began to afraid I couldn't take it anymore.
Last December, millions of vaccines expired and were incinerated by the National Agency for Food and Drug Administration and Control, NAFDAC. Given widespread vaccination fatigue and a decline in disease incidence, should people in Nigeria even care about getting COVID-19 vaccines anymore?
So from a scientific point of view, it makes every sense for everybody to get vaccinated so that everybody's on the same page. It's not necessarily it's no longer about the individual person who can say, well, I'm doing fine. But it's about, if you look at the long picture, the big picture, it's good for everybody to be on the same page.
Nigeria recently lifted other restrictions, including the mandatory face mask requirement. But the federal government is still warning that Nigerians should not let their guard down. Up to now, no one has really been able to explain why COVID-19 didn't hit Nigeria hard. But life has moved on here.
Professor Yap Boom has studied epidemics like tuberculosis, malaria, and Ebola. The microbiologist from the University of Yaoundé in Cameroon also teaches in the U.S. and conducts research for Doctors Without Borders. DW reporter Carsten Wirth talks to him about the different effects of COVID-19 in Western industrialized countries and in Africa.
So, Professor Yap Boom, great to have you here. So,
Some people say the COVID pandemic seems to be over in Africa. Would you really agree on that?
We can't say that COVID is over in Africa. We've been seeing different waves. Now we are having the fourth wave of COVID that happened around December, January in most African countries. So we might be in between two waves, the fourth and the fifth, and also most likely we might be going toward having COVID as an endemic disease in the continent. So it's not over, but what is true is that there are very few cases. If I take the example of Cameroon, where I am right now, there is only one patient that is hospitalized because of COVID in the entire country, showing that there is a real decrease of the number of cases and also of the number of deaths because of COVID.
Let's talk about vaccination. The highest vaccination rates in Africa, around 30% approximately. A lot of countries have much lower rates. What efforts are still being made to change this? Maybe also to avoid the spread of new variants.
Yes, it's important to understand the dynamic of the vaccination and the vaccination hesitancy from the perspective of the population. Most of the countries that have intense vaccination strategy are also, talking about the West, also those that have been the most affected because of the number of deaths. If you take the example of now, I know North Africa, South Africa, they've managed to push to vaccinate importantly the population. And remember that the vaccine that we have currently, the effect is actually to reduce the severe form of the disease. So it's quite challenging to now convince the population to go toward those vaccines, especially now where the cases are very rare.
Which strategy do you think makes sense in order to be better prepared for future pandemics in Africa?
I think the most important, according to us, is first to have surveillance, an important surveillance system. And to have a proper surveillance, we need to carry on testing. What we do in many countries, though the number of cases are reducing, is to intensify the testing at the airport, because that's where usually the virus is coming. So if we manage to catch the virus from the airport, one, we'll be able to isolate and to take care of those people. Two, the vaccination. The vaccination remains a really important tool, especially for those who are at risk. And we know that those who are age below young 50s, those who have comorbidities. So if we intensify those two, and the third one is the community engagement, the community has to be part of the response. If not, then we won't have the success that we want for the next pandemic, for the next variant, but we really need to have them as part of the solution. So we really need to push more on the traditional medicine, on how those people can also be integrated as part of the response. We'll go in the place where those people are integrated in our health system. And I think COVID has shown us that we should rely more and more on what we have in the ground and see how we can complement with the modern medicine.
Professor Yaboom, thanks for the interview.
Okay, bye-bye.
All right.
The importance of education and gaining awareness about the pandemic is evident in Ghana. Fewer and fewer people are getting vaccinated there because they don't think that COVID-19 is dangerous, and many consider restrictions unnecessary, especially in rural areas. We met a nurse in the Ghanaian capital, Accra.
Kobe Blay works as a nurse in this ward at Ghana's Korle Bu Teaching Hospital in the capital of Accra. At the peak of the COVID-19 pandemic, he spent most of his time telling people about the virus, encouraging them to get vaccinated and observing safety protocols. But Blay is now worried that all the gains made over the past 2 years could soon be reversed, as people are no longer observing the safety measures.
I mean, it's quite worrying to find out that people have distanced themselves from taking the action. The energy and the drive has gone down significantly. It also means that should the virus pop up anytime soon or any other thing pop up soon, it's very likely that it may be difficult to handle all over again.
Today, he is visiting a vaccination centre over 360 kilometres from the capital. The place is virtually empty, with many still yet to show up to get their jabs. Blay is disappointed at the lack of enthusiasm.
It's quite worrying, and it means that all the gains that have been made might be rolled back, which would be unfortunate. I need to be safe, my family needs to be safe, my colleagues need to be safe, and loved ones need to be safe.
Only 5.7 million of the total population of over 30 million have gotten their COVID-19 jabs. Johnson & Johnson, AstraZeneca and Pfizer vaccines are available, but more doses have yet to be secured to cover the rest of the population. Training workshops like this one are to prepare healthcare workers for improved COVID-19 educational campaigns in rural communities. Ghanaian health authorities want to remind the populace that COVID-19 isn't over just yet.
We haven't gotten there yet. We still need to do the education. We still need to let the people know we are not out of the woods. We still need to let people know vaccine is available. They need to take it so the majority of the people will be protected.
On the streets, paintings like this are helping to emphasize that. But citizens have mixed reactions on whether COVID-19 is over or not.
There are no longer active educational programs about COVID on the radio or even at information centres, so I don't think COVID is still there.
I think there was an outbreak of COVID because there was a lot of information on it. But I never saw anyone with symptoms. So there was COVID, but it's no longer a big deal.
In reality, COVID is still there. So though the government said we shouldn't wear masks or it's not mandatory, that's how he said it. So people are taking advantage of that, saying COVID is gone. As far as the government said, it's not mandatory. But seeing if you want your own health to be at a safer place, you have to do what? Wear your mask and follow the protocol.
Kobe Blay hopes his efforts at reminding people about the presence of COVID-19 makes the necessary impact sooner rather than later in order to save lives.
Masks are being worn less and less around Europe, even indoors. People still wearing masks in Spain are doing so voluntarily. But doctors warn that doing without the most basic protective measures is premature. Infection rates in Spain are rising significantly. Some already predict the next wave fast approaching.
Diego Velázquez's maidens are no longer the only ones who are allowed to show themselves without a mask in Madrid's Prado Museum. The mask requirement in Spain is over, even indoors. Masks are only recommended. For many here, this is a new feeling that they're savouring carefully.
I'm free. I feel the freedom. Yeah.
I feel the freedom of not wearing the mask, but that's because the space is very open here. It's very large space. But if it was a little space, it would be not very secure, I think.
I think it's a good thing. At the same time, we should make the immune system work a little bit.
The Spanish Ministry of Health assumes that the danger posed by COVID-19 has decreased significantly, also because of the high vaccination rate of over 90%. For Carlos Chacuaceda of the Prado Museum, it's a good opportunity to relax indoors too. It was a bit strange that you could be in the museum cafeteria without a mask. And when you got up to see an object or tour the rooms, you had to put one on. In any case, I think that the most important thing here is general precaution. And I carry one in my pocket, and if there's a crowd, I'll put it on. Or if I get into an elevator, I'll put it on. But it's also wonderful to feel the freedom again, to look at people's faces, to see their smiles. The feeling of relief after more than 2 years of pandemic prevails, but doctors are concerned about the new mask freedom. Julio Armas Castro works in the emergency room of a hospital in Elche in southwestern Spain. The country has recently been implementing a new corona strategy. Infections are only counted in certain groups. I think removing masks indoors without taking into account that we're at an endemic point may not be the best idea. Let's remember that only vulnerable patients who have COVID or patients over 60 are being diagnosed. We're missing the real incidence. Since the mask requirement has gone away, the number of infected people in his hospital is rising again. Many younger people are also being admitted with symptoms. I'm not worried about the incidence rate of Omicron because we already know how Omicron works. I'm concerned about what comes after the Omicron variant. A more infectious and aggressive variant may emerge that causes severe disease, and this could cause higher mortality because we still have high mortality from COVID. The doctor says he would still go to the museum if it's not too crowded, and only without a mask when the incidence has dropped significantly. A new ventilation system was installed in the Prado because of the pandemic to reduce the risk of infection. Here too, it's clear to everyone that the situation could change again quickly.
In Dubai, one could be forgiven for thinking the pandemic ended long ago. As countries around the world closed their borders, the Desert Emirate boasted that it's a safe destination for tourists. But this perceived normality didn't just come by itself. Strict restrictions and mask mandates kept infection rates low. It's a pandemic success story that worked well.
With the longest slide measuring 450 meters and the steepest of them enabling speeds of up to 70 kilometers per hour, the Aquaventure Park in Dubai is quite the tourist attraction. Usually it welcomes 6,000 visitors a day from all over the world. But when the pandemic hit, the park's future was thrown into doubt. Zasha Trima, who is in charge of its 800 employees, was worried. But the United Arab Emirates, which Dubai is a part of, quickly came up with a plan: implement tight coronavirus restrictions to get public life going again. And tourism too. It's one of the country's most important sources of income. People here had to wear masks both indoors and outdoors. You could get a PCR test on every corner, and COVID vaccines became available for everyone in early 2021.
So people really didn't talk about it. Restrictions were simply imposed. You had to get vaccinated, but it was free of charge. And I think Dubai or the UAE had a relatively fast and high vaccination rate, over 90%. It was then, of course, also really good for tourism, and I think it helped bring tourism back to the region relatively quickly.
The so-called Dubai model worked. The UAE was able to keep infection numbers low. By mid-2021, when many countries had closed their borders, Dubai was once again a sought-after destination. It was helped by hotels like the Atlantis meticulously following the regulations. With more than 1,500 rooms, the Atlantis is almost a small town. The water park is part of it. Jörg Unger is in charge of the hotel's 23 restaurants and 500 cooks. For months here, staff had to monitor the guests in the restaurants and make sure they followed social distancing, mask wearing and disinfection rules. It was an additional burden for the employees. Inside, as well as out, the requirements to wear masks outdoors was dropped only a few weeks ago.
I think it was worth it. It was the right strategy to approach this with strict rules and also to be very strict with distancing rules. We're almost able to totally forget about it.
Nevertheless, people here are anything but flippant about the pandemic. Perhaps precisely because Dubai fared so much better than other places. Issam Kazim is in charge of tourism strategy for the UAE. He says people remain cautious because they recognized how quickly the COVID strategy brought back a sense of normalcy.
So if you're walking in a mall and you've forgotten your mask by your chin, the resident or the guest next to you would look at you and say, can you please put the mask up? And I think that kind of brought the pandemic to more of the mainstream of people to realize that in order for them to be able to go about their life in a normal way, they need to respect these regulations. The fact that we were able to push through and come out the way that we did on the other side shows you that we are ready for such challenges to come up in the future.
The pandemic may hardly be noticeable for many vacationers at the Atlantis. There's still a mask requirement indoors, though. Germans Jörg Unger and Sascha Triemer sometimes hear about protests against coronavirus measures back home in the news, and about people who are reluctant to get vaccinated. They think things went better here because of transparent communication about restrictions, mandatory testing and vaccinations, and because many people's jobs are connected to tourism.
You can understand the people. You can also understand their fears. For us, the fears here are different. They're more about if guests don't come at all. So that's our fear, because that's what we live on.
If you talk to people who work in hotels, they often tell you the coronavirus is taking a break, but the pandemic is far from over, and people still have to be on their guard.
DW science correspondent Derek Williams keeps us up to date with the latest research and facts. Today he answers the question, instead of developing vaccines, couldn't we instead modify SARS-CoV-2 to make a light version of the virus that doesn't kill anyone?
This is a really interesting thought experiment. So let's start with what's scientifically possible. First, can we genetically modify viruses in highly specific ways to get them to accomplish highly specific tasks? Yes, we can. We've been doing it for decades in a wide variety of applications. And the molecular tools for editing viral genomes are now both powerful and very precise. Next question, can we predict whether changing specific genetic sequences will bring specific results? For instance, could we alter specific stretches of RNA in SARS-CoV-2 and know that that'll only make the virus more harmless? Well, that's shakier ground, but okay, some sophisticated modeling techniques can predict stuff like that. So let's call that a very guarded yes, too. But there are, of course, major problems. The biggest is that virus variants out in the real world also compete with one another, and how infectious they are plays a central role in success. So to have a chance to spread widely, our theoretical modified version of SARS-CoV-2 would have to be not just harmless, but also really infectious. You see where this is going, right? I mean, every time viruses replicate, they can mutate. So, big question, do you really want to introduce a highly infectious, supposedly harmless version of the coronavirus when you know that it won't necessarily stay that way? That's a really risky proposition. And how do you think that people would feel about being intentionally infected? Although in a way, that's already what we do with many of our vaccines. What are called live attenuated virus vaccines for diseases like anthrax and rabies have been around for well over a century, highly simplified. The concept is basically to selectively breed human pathogens in other animals. There, they become less and less virulent to humans until you reach a generation that's pretty much harmless for us, but can still leave a lasting protective memory on our immune systems. By then, though, the pathogens in live attenuated vaccines are so bad at replicating in your cells that they don't really make you infectious to others. Infection with a live attenuated vaccine therefore has to be intentional through vaccination, not unintentionally by a genetically modified virus that we've altered to be highly infectious but hopefully harmless. That's a really different thing.
So is the pandemic over or not? That's the question we all want answered. Tune in next week as people from all corners of the globe share how the pandemic has fundamentally changed their working world. We hope you'll join us. Goodbye and stay healthy.